Hello guys, so myself Dr. Farheen Khan, and today I will teach you the anatomy of mandible. So let's begin. Hello guys, so today we are going to learn about the anatomy of mandible. Okay, so let me give you a short introduction. This is mandible. So the mandible or lower jaw is the largest and strongest bone of the face. Okay, it is the largest and the strongest bone of the face. It develops from the first pharyngeal arch. It has a horseshoe shaped body which lodges the teeth. You can see it is horseshoe shaped, right? From here you can horseshoe shaped body which lodges the teeth. So it lodges the mandibular teeth. A pair of rami which projects upward. This is the pair of rami from the posterior end of the body and provide attachment to muscles. This is pair of rami, one this and one this side. Now the parts of mandible. So we will be learning about the body of the mandible and the ramus of the mandible. Now the mandible consists of each half of the body of the mandible consists of two surfaces. This surface is outer surface of the mandible and this is the inner surface of the mandible, and we have two borders, which is upper border and this one is lower border. Okay, so outer surface of the mandible, this is learn about the outer surface of the mandible. This is symphysis manti, the line at which right and the left half of the bone meet each other. So you can see this is the symphysis manti. Here you can see this is the mental protuberance. This one is the mental protuberance. So it is a median triangular projecting area in the lower part of symphysis manti. Here you can see the mental foramen lies below the interval between the two premolars. Okay, and we have oblique line. It was downward and forward toward the mental tubercle. Okay, oblique line which run downward and forward toward the mental tubercle. Here also it is having same oblique line, and here also the mental foramen. Let us talk about the inner surface of the body of the mandible. Here you can see the mylohyoid line, a prominent ridge that runs obliquely downwards and forward from below third molar. So here you can see this is the mylohyoid ridge which is running obliquely downward and forward below the third molar. It is present below the third molar, you can see, and it is written like this. Then we have submandibular fossa below mylohyoid line, forms slightly depressed area. Okay, then we have genial tubercle. So the posterior surface of symphysis manti, okay, markers by four small elevations. Here you can see there is a four small, I have already marked it. So this is genial tubercle. You can see the elevation here, four small elevations. Then we have mylohyoid groove below the posterior end of the mylohyoid line. Okay, so we are having the mylohyoid groove. Now let us talk about border of the body of the mandible. This is the upper border and this is the lower border. So the upper or the alveolar border bears socket for the teeth. You can see bear the sockets for the teeth. Okay, the lower border of the mandible is called the base of the mandible. Near the midline, the base shows an oval depression called the digastric fossa. Now come to the ramus of the mandible. The ramus has two surfaces. It is having lateral and the medial surface. Four borders: upper, lower, anterior and posterior. And then we have the coronoid notch and the condyloid process, which is this one. This is the condyloid process and this is the coronoid process. Similarly, same coronoid and the condyloid process. So the lateral surface is flat. As you can see, it's flat. And it bears number of oblique ridge. And the medial surface, it is the mandibular foramen. This is the mandibular foramen, this one. Lies little above the center of the mandible at the level of the occlusal surface of the teeth. Here the occlusal surface of the teeth, so it lies above. Lingula. This is the lingula. This is lingula. Anterior margin of the mandibular foramen is marked by a tongue-shaped projection towards the head of the mandible. Okay. Now the border of the ramus. This is the border of the ramus. The upper border of the ramus is thin and is curved to a downward, forming the mandibular notch. The lower border is backward, continuous with base of the mandible. So the lower border is backward, continuous with the base of the mandible. Anterior border is thin. Posterior border is thick. Superior part of the mandible, this is the condyloid process. A strong projection from the posterior superior part of the ramus. The head is covered with fibrocartilage and articulate with the temporomandibular bone to form temporomandibular joint. Coronoid process is flattened. This is the coronoid process, which is a flattened triangular upward projection from anterior superior part of the ramus. This is mental foramen. Transmit the mental nerve and vessels. So this transmit all the mental nerves and vessels. This one. Mandible foramen. Passes through inferior alveolar nerve and vessels. Mylohyoid groove. Mylohyoid nerve and vessels lies in mylohyoid groove. This here is mylohyoid groove. Medial surface of the ramus. Medial surface of the ramus, lingual surface related to it. Then the mandibular notch. mesenteric nerve and muscles.
Yeah.